Hello, I'd like to share with you some of my own background in clinical practice of 40 years. Some of my clients, my clinical approach. My clients have been basically individual, marital, and family client systems that I've seen in single system and group of systems by myself and often with a co-therapist in the form of clinical supervision. Some were short-term evaluation and intervention for adjustment disorders and conflict resolution, like we often do in building relationships. Some were longer-term psychotherapy that included EMDR for trauma and psychodynamic psychotherapy for personality disorders and dissociative identity disorders. Currently, I'm in my practice setting. I am taking referrals from neurologists, neurosurgeons, and physiatrists for behavioral medicine evaluations. I work with clinical pharmacists to review a comprehensive medication history and to include the prescription monitoring program for controlled substances, and a systems-oriented psychiatric interview and a neuropsychological assessment to recommend modifications to the chronic pain management, including medication adjustments and integrative medicine techniques such as acupuncture, hypnosis, rehabilitative yoga, and trauma-focused EMDR. What are the typical problems that they present with? Anxiety, depression, obsessive compulsive tendencies, psychosis of self or family member, chronic pain due to injury, illness, partially successful surgical interventions, or collaboration with epidural steroid injections and spinal cord stimulators. What modalities do I work with and have I worked with? Cognitive behavioral therapy, EMDR, Ericksonian hypnosis and strategic hypnosis, family systems a la Jay Haley and Harry Galician, depth psychology from Carl Jung to Rollo May. The use of the specific technique is really consistent with the unique presentation of the client, and that may change in the course of the healing process. Most recently, and in terms of training, I have been a mental health first aid instructor since 2015, which has become my new passion, a way of expanding my impact and my ability to help others reduce the stigma of mental illness and to raise abilities in being able to guide them and direct them to more professional and effective help. I've been fortunate to include this in the PharmD curriculum and teaching all of my students who are now practicing pharmacists. I've been attending NatCon, the annual conference of the National Council for Behavioral Health, and that has made available to me a splendid diversity of training opportunities and professional networking that has benefited both my professional practice and my teaching at the Appalachian College of Pharmacy. I'm still looking, I think, for something that is comparable to what we experienced at NICAB at Hilton Head. The networking, the opportunity, the challenge to your way of thinking. In addition, I completed the Ericksonian hypnosis certificate training with Bill O'Hanlon last year and obtained the professional gerontologist certificate from the National Association for Professional Gerontologists. This year, I'm working on the Mind, Brain, Gene webinar of John Arden, along with one of my colleagues, U.S. Rao, who is a specialist in epigenetics and on the faculty with me. And we are both excited and sharing from our comparable perspectives. Thank you very much for the opportunity to get to know you.